Hello, my name is Maria de Los Angeles Molina and I'm a research analyst at Young Lives. Today, I will be presenting on how we collected GPS data on our 2021 phone survey. Young Lives is a mixed methods multidisciplinary longitudinal study that has been collecting data over a 20-year period. Our main purposes are to improve our understanding of the causes and consequences of child poverty and provide evidence to improve policies and practices. Since the early 2000s, we have been following nearly 12,000 children in 4 countries: Ethiopia, India, Peru, and Vietnam. We have studied the role of inequalities over the life cycle, and during this time, we have been successful at keeping low attrition rates. In this slide, you can see the study structure with more detail. We followed 2 groups of children in each country, a younger cohort of roughly 2,000 children born in 2000 and 2001, and an older cohort of 1,000 children born between 1994 and 1995. The first round of data was collected in 2002, and since then we've had 5 in-person survey rounds until 2016. With in-person data collection interrupted by COVID-19, the study adapted to the new reality, conducting the Young Lives COVID-19 phone survey series. 3 calls were completed in 2020 and 2 more were completed in 2021. During August 2021, we conducted call 4, which was a short keeping in touch call designed to check in with our participants. On this occasion, I will introduce you to a pilot we conducted during this call to explore collecting detailed location data remotely. More specifically, we wanted to obtain the GPS points for the current household address for our participants. We had collected this data in the past during our in-person survey rounds, but due to COVID, this was no longer possible, leading us to implement a new form of data collection. So now I want to briefly mention our motivation in collecting this data from our participants. GPS data is important to us to keep updated and detailed location information from our participants, which facilitates tracking in between rounds and reduces attrition during data collection periods. There is also an increased interest in linking survey data with open access geospatial data. Detailed location data in the form of GPS data allows us to explore matching our databases with other data, opening up the possibility of new lines of research. Related to the first point on tracking, GPS data allows us to follow up on movement and migration among our participants. With these purposes in mind, we decided to conduct a pilot to evaluate the feasibility of collecting participants' GPS at home. The pilot would give us information on rates of eligibility and compliance, while also allowing us to test a new tool in a smaller sample, testing how easy it would be for our participants to use it and how accurate is the data that the platform collects. Moving on to some practical aspects, I will now introduce you to how we collected the data. We designed a brief survey using an online data collection platform. This survey included some questions on personal details to assure that we make the right match between the data collected and our databases. This was translated into local languages. A subsample of 200 eligible participants were invited to take part on the pilot after having completed the phone survey. Eligible participants were those who have a smartphone and have internet access at home. This could either be using a Wi-Fi connection or a data plan. Enumerators asked for oral consent at the end of the phone call. A subsample of participants received a unique link which included an encrypted ID, and this was sent by WhatsApp or text message depending on the participant's preference. Then the participants had to complete the survey when they were at their home address. On this slide, you can see some screenshots on how the survey looked for the participants. The first screen showed the participants some brief instructions and asked for written consent. When invited to take part on the pilot, participants were instructed by the enumerators to complete the online survey only when they were at their home address. This was done to ensure that we were obtaining precise information about the location of their home address and not an alternative location from where they were answering the survey. So we included a question on the online survey to verify this. If the participant answered yes, they were allowed to continue with the survey. If the participant pressed no, they were redirected to a message reminding them that they should complete the survey when at their home address. After inputting some personal data such as name, date of birth, and mobile numbers, participants pressed a button to send their location, just as you can see here on the screen. Participants took approximately 2 to 4 minutes to complete this exercise. The table in the slide shows the characteristics of those participants who were eligible to participate in the pilot. Remember that eligible participants were those who had a smartphone with access to internet connection at home. As you can see, there are some differences across countries, especially if we compare Ethiopia, where only 32.5% of the sample was eligible to participate, against Vietnam, where 89.9% was eligible. We also observed some demographic differences across gender, wealth, and education level. In India, for example, male participants were more likely to be eligible than female participants. Also, urban participants were more likely to be eligible across the 4 countries, and unsurprisingly, more participants from the wealthier group had access to a smartphone with internet connection at home. Education level was also different, as participants with secondary education or higher were more likely to be eligible to participate than those with primary education or less. So now I'm going to cover some of the things that we learned while conducting the pilot. First, let's look at how it worked. The survey we designed was relatively easy to access and use. Take a look at the figure below. It shows the total number of call for participants, the number of participants who were eligible to participate, the number of participants who were invited to participate per country, the number of those who completed the online survey, and those who successfully submitted their GPS data. As you can see in the yellow and orange bars, almost all of the participants who completed the online survey were also able to submit their GPS data. We had the possibility to run accuracy checks with previously collected data, which is a comparative advantage that we have as a longitudinal study. We ran checks comparing the GPS coordinates collected during our pilot with the ones collected in the last round of data collection in 2016, and found that the data collected was quite accurate in the cases of those who hadn't moved home between 2016 and 2021. The role of enumerators was key. Our country teams have worked with the same team of enumerators for almost a complete length of the study. Inspiring trust was crucial to convince our participants. Now moving on to some of the challenges we experienced. First, human error, which is of course inevitable. Our partners in the countries mentioned that participants many times just forgot to complete the survey. Also, some participants experienced issues when trying to share their GPS data, as the privacy settings in their mobile phones didn't support sharing their location. Participants also raised some concerns about cybersecurity. For example, participants from India and Vietnam mentioned that they were worried that by completing the exercise, they would give others access to private data linked to their mobile phones. Also, our initial idea to carry this on a small sample was challenged, as if you were able to see in the previous figure, we ended up with a much larger sample, and even in India, nearly the entire eligible sample was invited to participate. Last but not least, we ended up with a biased sample, in which rural, poorer, less educated people are less eligible in all 4 countries. However, once they are able to enter the survey, these groups are as likely as their counterparts to complete the survey. Finally, we realized that data collection in Ethiopia was not feasible, not only because of low eligibility, but we also needed to take into account the current context of internal conflict and security concerns raised by our participants. We even mentioned that they were willing to drop out of the study rather than sharing their GPS data with us. One last point in the learnings is that the pilot provided us with helpful evidence to make decisions on how to continue collecting location data remotely in the 5th call, when the link to the GPS online survey was shared with all eligible participants. For this new phase, we introduced some modifications to dealing with rejection and compliance. For example, we introduced an extra incentive for participants in India to compensate them for their time and willingness to participate on the online survey. We also formalized a follow-up system implemented informally by some countries during the pilot. Other set of modifications were related to the technical aspects to improve data collection. We simplified the process for enumerators to share the link with participants. We also asked participants to submit their GPS data when standing outside, and this was especially when they were using a data plan, and this was to increase accuracy. Finally, the new survey includes some additional tips and hints to help participants to complete the survey successfully. Finally, I want to briefly touch on some ethical considerations. First, it is to consider the sample. For any further use that we do of this data, it is important to understand who is being left behind and who is being included. Second, we are reflecting as a team on the ways in which we are asking our participants for consent. How can we inform them clearly of the uses we are going to do of this data? On another point, we see a tension in asking for individual consent when collecting sensitive data from a household. What happens with consent from other household members? Finally, as this is sensitive data, it will not be publicly released. Some next steps. In 2023, we plan to go back to the field with an in-person round and expect that this data will be useful to find and track some of our participants. We're also wondering if collecting GPS data through a mobile phone can be used as a tracking strategy in between rounds and used to collect data when we go back to collect data in person. Last, this new way of data collection has allowed us the opportunity to explore possibilities of collecting other types of data using online surveys. Thank you so much for listening. I'm looking forward for your comments in the Q&A session.